Welcome to today's webinar. My name is Susan Howley, and I am Project Director for the Center of Victim Research. We're so glad you took the time to join us today for using VOCA funds to help domestic violence survivors obtain safe and stable housing, the DV Housing First model. This webinar is produced by the Center for Victim Research. CVR is a one-stop resource for victim service providers and researchers to connect and share knowledge. We are ourselves a partnership of researchers and practitioners at the Justice Research and Statistics Association, the National Center for Victims of Crime, and the Urban Institute. And the CVR was funded by the Office for Victims of Crime as part of their effort to live out Vision 21, which called for a greater integration of research and data in victim services. So this webinar and all of our activities are supported by funding from the Office for Victims of Crime. And with that, it is my very great pleasure to welcome today's presenters, Dr. Cris Sullivan and Elizabeth Eastlund, who are going to share with you all about the DV Housing First model. Cris?
All right, thank you, Susan. Before we get started, I wanted to just let you know what we're going to be covering today, and we will definitely leave plenty of time for discussion because we know that a lot of you have a lot of questions and thoughts and comments, and this could be a great way for people to learn from each other. So what Elizabeth and I want to cover today is we'll first just do a very brief overview of why this is even a necessary topic, the interrelationship between domestic violence and either homelessness or housing instability. And then that'll lead us to talking about VOCA's expansion into supporting housing efforts, because that's relatively new. We'll talk about DV Housing First as a promising model that more and more states are thinking about or doing, which led us to do a process evaluation of DV Housing First in California. And process evaluations are really trying to figure out what does it take to do this. So we're looking at how can this work, what does it look like, what are the lessons that we learned from doing this in California that might be useful for people elsewhere. Elizabeth is then going to explain how this worked for her organization, Rainbow, in Los Angeles. So I think we have some really exciting things to share with you today. I want to quickly just say that whether you're looking at homeless families or domestic violence survivors, you're going to see a large overlap between DV and homelessness. In research that has asked homeless women with children about their experience of domestic violence in the past and sexual violence, over 80% have experienced this type of violence in their lifetime. If you talk to domestic violence survivors, you'll find that housing instability is 4 times more likely for them than for women who have not experienced domestic violence. So whether you're looking at homeless women or domestic violence survivors, you're going to find this overlap. And then, interestingly, 1 in 4 homeless women will cite domestic violence as a major contributor to their current homelessness. So not just about experiencing victimization in the past, but it was a direct precursor to their becoming homeless. And this happens directly and indirectly. You can have abusers intentionally, economically abusing survivors, making them lose their jobs, kicking them out of their homes, stealing their money. And then there's also the indirect route to homelessness by the PTSD possibly or depression that somebody experiences after dealing with domestic violence. So there are a lot of different pathways to homelessness, and we just know that it's a serious, serious issue. The other thing is homelessness does not happen equally across all groups. That we know that racial minorities experience homelessness in greater numbers than do white families, even after you control for poverty. So this is not about African Americans, as you can see in this slide, being more poor. It's that even after you control for poverty, African Americans are more likely than whites to become homeless. This slide is from the SPARK study that we can send you information about, and it holds true also for Latino families and Native American families. So in response to all of this, OVC passed the VOCA final rule in 2016 to clarify how we can use VOCA, victim assistance funds, to help people obtain safe and stable housing. And I'm just wondering if people don't mind telling us how many VOCA administrators are on the call. You can use the raising hand, so let us know how many VOCA administrators are here. I know that this is going to be especially helpful to you. And while you're doing that, let me just walk you through what we learned from the VOCA final rule. Basically, it was set up to expand how people can spend VOCA funds to support safe and stable housing in a number of ways. It really was designed to provide states with more flexibility and maximum flexibility to address housing needs. I'm going to talk about that in a minute, particularly when housing loss or instability is a result of victimization. And they have a real emphasis in this rule on transitional housing and relocation expenses. When it comes to relocation expenses, that's a lot of different types of expenses. That's moving expenses, storage fees, security deposits, travel expenses, rental expenses, even paying somebody's back rent, paying somebody's back utilities, current utilities, utility startup. And then I really like this last one, which is the other costs incidental to relocation, which I think there's a lot of room for interpretation there. And that's that flexibility. It's really working with individual survivors to make sure that we're providing the kind of assistance that's really going to lead to their being stably housed. Transitional housing is another use of VOCA dollars now, as well as sheltering victims of domestic violence, human trafficking, and sexual assault. So some other uses of the funding is housing advocacy, staffing such advocacy programs, administering those types of programs, dealing with children's needs, because children's needs are really related to homelessness and housing. Transportation, same kinds of things, as long as it's really trying to help people obtain safe and stable housing, because we know without that, it's really difficult to get back on your feet. It's really difficult to get stable in your life if you're not stably housed. Okay, so now more and more states are thinking, wow, this is a lot of money we might be able to spend in this area, and it's exciting. So what are the models out there that we might use? So as I mentioned, you can use it for transitional housing, sheltering, but people were looking for models that are evidence-based or evidence-supported, because there's more and more of a pressure to do that. And one housing model that's been gaining a lot of attention and was gaining a lot of attention in 2016 is the DV Housing First model, which was really out of Washington State Coalition Against Domestic Violence and originally funded by the Bill and Melinda Gates Foundation. So I wanted to tell you a little bit about this exciting model. There's three core components to the DV Housing First model. The first component is that advocates engage in survivor-driven, trauma-informed, mobile advocacy, and I'm going to explain that on the next slide. The second is the importance of having flexible financial assistance. Every survivor situation is different. One person might desperately need their utilities covered, another person might need storage fees, another person might need security deposit. It's really important that we have flexible financial assistance. And third, this isn't going to happen unless advocates are really engaged in the community, developing relationships with landlords, housing authorities, as well as other community members who can provide resources, services, assistance, and supports. So just to quickly go through these. The first, the survivor-driven, trauma-informed mobile advocacy. Survivor-driven simply means that advocates focus on needs identified by survivors. It's not predetermined by agencies. And while we'd like to believe that all agencies do that, in reality, many don't. They say, this is what we offer. Would you like to come to our support group, or we can help you with safety planning? But they don't always see that some of the other needs identified by survivors, like I need to go back to school and get a degree. I need help with child care because I lost my child care provider, and if I don't get this taken care of, I'll lose my job. These are all things that some domestic violence advocates might say, that's not my job, and we're arguing, yes, it is. Any need identified by survivors, because they are whole people with a range of issues in their lives. The mobile piece comes from advocates leaving the agency, going out to survivors in their homes, in their communities, maybe helping them look for housing, helping them look for jobs, helping them go to medical appointments. It's mobile in the community. And finally, the importance of trauma-informed practice. We could do a whole webinar just on that, and there are many webinars just on that. That's understanding that domestic violence is a form of trauma, and some people have had real trauma reactions. Depression, PTSD, experiencing the trauma again, having difficulty sleeping, difficulty working and concentrating. And if advocates understand those common responses to trauma, they can then educate survivors and help them normalize what they're going through, and also be patient about how to work with them effectively. The flexible funding. We need flexible funding related to housing. So as we talked about, the rent, the utilities, but we also need funds that are critical to housing stability but are not specific to housing. So getting those tires fixed on a car so that the survivor doesn't lose their job, getting that child care taken care of, fixing a refrigerator, those types of things that may seem tangential to housing, but they really are very related. As I mentioned, the community engagement is critical. That's giving advocates the permission and the skills to be out in the community, meeting with housing providers, networking with service providers, really working with community members, and not just focused individually on individual survivors. These are the three key components to the DV Housing First model. I don't want to spend a lot of time on the evidence for the model other than to tell you that there is evidence for this model and wanted to share it with you where you can find more. I and colleagues did a study of the importance of flexible funding. So we looked at people who got flexible funding and short-term advocacy from a very innovative program in Washington, D.C. These were all homeless or really precariously housed individuals when they received the flexible funding. We interviewed them 6 months later, and 96% were housed. There was an early evaluation of the DV Housing First model in Washington State that the Bill and Melinda Gates Foundation funded that found that survivors were housed and doing well 18 months later after they received the services. A number of years ago, I did a randomized control trial looking at the importance of mobile advocacy and found that survivors who received that type of advocacy were safer, had higher quality of life compared to people who did not receive that, who were in the control group. So there is very promising evidence for this model, and more people were getting excited about it. But the question became, how do you do it? People would hear about it and say, well, those three components make sense, or I'd like to try that, but they just really weren't sure how to go about it. So in California, the VOCA administrator in the California Office of Emergency Services, also called Cal-OES, decided to pilot the DV Housing First model with their VOCA dollars, and they funded 8 programs the first round. And the Blue Shield of California Foundation, who works closely with them and works closely with the State Coalition Against Domestic Violence in California, came to me and said, would you do an outcome evaluation of this? We need more evidence. Let's look at whether this works. For those of you who are less familiar with evaluation, let me just explain for a second. An outcome evaluation is looking at, does this program lead to positive change for people over time? Did it make a difference for them over time? And that's what they originally asked me to do. But I had a great conversation with them and with some of the grantees and said, you know, you're funding a lot of agencies who've never done this model before. It's going to take them a year just to figure this out, just to do some trial and error, try a few things, really get it stabilized. So I think it's too premature right now to do an outcome evaluation. Plus, for those of you who may not know, we're doing a very large outcome evaluation right now in Washington State. But what really is missing is a process evaluation. And I explained to the Blue Shield of California Foundation that while people want to do this, they don't really know what it takes. So would she be willing to fund a process evaluation so that we can share those learnings with other people? And they were very excited about that. We worked very closely with Elizabeth Eastlund at Rainbow to make all this happen. And that's what I want to share with you about with this process evaluation, because it really gets into the nuts and bolts, which is exciting. So 8 agencies received this initial funding. 7 of them felt able to participate in a process evaluation. And the purpose, again, was to document with them what it takes for agencies to actually implement this model, and then provide preliminary evidence for its impact. So while it was too early to do a full-blown outcome evaluation, we did want to help agencies look at how they could evaluate outcome in the future. We gathered a lot of information. This was a year-and-a-half project, I think. We first of all talked with key staff members at each of the 7 agencies, talked about how much money they got, how they were spending it, what was working for them, what they had to change. We then did site visits so that we could actually see how this was working on the ground and working in different areas, because this is going to look different in a real urban area than in a more rural area, in an area that has a lot of resources compared to an area with fewer resources, in areas where housing is extremely expensive, et cetera. So we wanted to get that context. While we were on the site visits, we talked to clients about their experience with the DV Housing First model, and we also asked all of the agencies to track in an Excel spreadsheet that we created how they spent their flexible funding, what they spent it on, and what impact it had. And then they sent that to us at Michigan State University, and we documented how the money was being spent and the impact it had. It was really exciting with this wonderful group of people who were willing to work together to develop a client feedback survey. So we also, as a group, created what would be a very simple anonymous survey that they could then use, give their clients to get feedback on what was working and what needed to improve in their model. So I want to hit just some of the highlights for you. We have a full report on this. It's available on the DV Housing First website that we're going to share with you later. I know Susan will be sending out a follow-up email, and so you will get a link to this report. So don't worry about that, but I just wanted to let you know some of the key findings. When we asked people how they made mobile advocacy happen in their agency, what are the kinds of organizational things they had to put in place? The 5 most common were they had to figure out how to reimburse their staff and reimburse them quickly for mileage, because now their staff are putting a lot of mileage on their cars if they were using their personal cars. They made sure that their staff had laptops if they were out in the community, and cell phones. They had to look at their insurance. Some of them already had insurance covering mobile advocacy. Others had to figure out how to make that work. A couple of them already had agency cars, and they felt more comfortable using agency cars than staff cars. So these were the 5 most common for mobile advocacy. We looked at that tracking system that I talked about and how people used their flexible funding. And we looked at the proportion of money used for rental assistance compared to everything else. And this A1 through A7, those are just codes for the 7 agencies participating in the evaluation. I want to draw your eye to A5, the 5th program in here, as well as A4, and say that these were housing organizations with an attention to domestic violence survivors, but they were not domestic violence organizations. They were housing organizations, and they were used to receiving HUD funding that was very restrictive about how they could spend their funds. And when I asked them why they spent so much on rental assistance and not the more flexible assistance, they were saying that they just didn't quite trust that they could. It was just a really new way of thinking for them. So it was interesting that some, you'll see the 7th agency they used a lot of money for things other than rental assistance. But again, I think we need to individualize it. We need to make sure that people understand they can use it in different ways, but also just understand that it's the context and what makes sense for each individual agency. The most common landlord engagement strategies were going to events, attending meetings, using a housing coordinator to communicate with landlords. So there were a number of different creative strategies used, but there's a lot of variability across the 7 organizations. The community engagement ranged from having relationships with people who would offer free services or discounted services. One agency worked closely with a car mechanic who would provide a lot of their services for free, having strong relationships with local housing authorities, going to coordinated entry meetings. This was all in California, and everywhere there's very limited housing and it's very expensive. So these folks had to be very creative in how they made all of this work. Some of the challenges with flexible funding is that these agencies, when they applied for the funding, were extremely generous and wanted to put as much of the money as possible into money for the clients, and they didn't put enough into administrative costs. And as Elizabeth's going to explain to you, there's a lot of administrative costs to getting funds like this out the door quickly. Having to figure out how to use the funds. Do you cap them? Are there things you can't use the funds for? Trying to work with the state funder who was trying to deal with OVC, who was still figuring this out as they went along. Whether to provide funds directly to survivors rather than cutting checks to third parties. These are all issues that came up as really important. Challenges with the landlord engagement is, why should landlords deal with us in a tight housing market? So sharing those creative strategies, dealing with landlords who wouldn't accept third-party checks, DV agencies where maybe domestic violence is even in their name and not wanting their name on a check because that would disclose that somebody had been receiving DV services. So a lot of challenges with that to work out. Some of the agencies wanted to weave this type of a program into their entire agency. Others used it as a standalone program, and we talked with them about their decisions around that. And again, that's in the report. It was really important to talk with staff about their impressions of the DV Housing First model, and I have to tell you, not just in California, but in Washington, in Colorado, everywhere where this is happening, I will tell you the staff, the advocates love this model. Because as so many people say, it's so nice to be able to say yes. That when somebody needs something and maybe it only costs $200, but it's going to make all the difference in the world, that I can say yes to that is really key. So the staff and the survivors thought that this model had an immediate and profound impact on survivors. And again, Elizabeth has some examples for you. So moving a little bit into outcomes is, did the flexible funding impact housing stability? And you'll see here, one nice thing about this funding is some programs were able to help people not become homeless. So people could stay in their own home. They didn't have to leave their home to go into a shelter, or they didn't become homeless because the staff were able to get in and maybe pay that rent that the person got behind because maybe the assailant had moved out or destroyed property. So they were able to either stay in their own home, they were moving into a new home, moving from transitional housing to housed. So you can see people can track this with the tracker that we developed for them. So then we wanted to develop this really quick, easy client feedback survey that would be anonymous. We wanted to assess 3 different areas. First of all, we wanted people to be able to use this to see if they really were even providing the DV Housing First model. Were they providing the core components? And then measuring, was there a change in housing stability? Was there a change in safety? But also, you know, looking beyond that, we wanted to capture, was there just a change in people's life satisfaction and sense of hope for the future? So we all got together, created this survey, and they even agreed to pilot it. This was toward the end of the evaluation. So this is just a pilot. I really want to stress that. we just did it with 29 survivors because, first of all, we wanted to even just see if it could be done easily by staff, if clients were willing to fill it out. So this is just to let you know that these surveys may be really useful to programs. 29 people took the survey. 63% had been receiving services for less than 6 months. They were all female, and age range was between 18 and 60-something, but most were between the ages of 30 to 44. And these are the kinds of things you can learn about the program. Now remember, this is preliminary. This is 29 people. But we asked people that they could mark not at all, a little, somewhat, or very much to these responses. My advocate was flexible with our meeting location, so that's the mobile advocacy. Listened to me and I felt supported, that's the strengths-based, survivor-driven. Helped me reach my short-term housing goals, focused on my strengths, referred me to other community services, did safety planning with me. So these are all very high, and these are just the people who said very much. If we had included the somewhat, it would have been even higher. These are also just some outcomes that you can capture from these surveys. So feeling more hopeful about the future, which we know is a really important outcome for people. Being able to remain in my own home or secure safe housing. I have more ways to plan for my safety. For those VOCA administrators on the phone who are also FIPSA administrators, you know that that's one of the 2 FIPSA mandatory outcomes. We wanted to make sure that that was included on here. I have more ways to plan for my safety, and also I know more about community resources. I am financially more stable. Now, when I looked at that, I was a little disappointed that it was only 64%. I'll tell you, when I shared this back with the agencies, they were excited. And I think they had a really good point, because they said, when you consider how really badly off people were financially when they come to our services, to see that many already financially more stable over such a brief period of time, they thought that was a pretty huge change. So that was very helpful for me to hear from them. And then I have greater understanding of the financial power and control my partner used in our relationship. So these are just some examples of the outcomes that are on the form. And I'm going to turn it over to Elizabeth to talk about the kinds of lessons learned that we think would be really helpful for others interested in doing this model. Elizabeth?
Hi, thanks, Chris, and hello, everyone. I did want to point out that the process evaluation that Chris did in California was completed from beginning to end within 9 months. So we accomplished quite a bit in a very short amount of time, including bringing those 7 organizations together on 3 separate occasions. So in the first occasion, we did have all 8 organizations, so we did accomplish a lot in such a short amount of time. So that was pretty amazing. I think one of the biggest lessons we learned as an organization, and that kind of across the board all agencies agreed, was we didn't put in enough to administer the cost of running this program. For Rainbow, we really only asked to fill 1 full-time equivalent staff position, a housing advocate or housing coordinator, and we didn't think more through the process that our finance team goes through in cutting checks. So since then, we've identified other monies to be able to add a housing program aide who's kind of the liaison between our housing staff and our finance department to make sure that all the proper documentation is there. But also just thinking about the amount of money that is going out when we're supporting anywhere up to 30 to 40 families with rental assistance, we need to think about the cash flow in our finance department. And also for us, we took probably about 4.5 months to really think about how we wanted to run our program. While we had written about it to request the funding, it's another thing then to implement the program. So allowing time for startup activities, I would say at least 2 to 3 months, if not more, to get acquainted with the other housing opportunities in the area, especially if this is the first time as an organization you're going out and doing or supporting rental housing or doing mobile advocacy. You need to really think about the procedures and policies you want to put in place to keep staff safe, to keep survivors safe when they're meeting in the community, and also to get to know kind of the housing process. Rainbow had already been very much connected to our housing and homelessness organizations within our community, which was helpful, though it still took us time to really start up the program. And then, you know, for a good while, we were not clear about how the funds can and cannot be used. And we would ask, is there a clear rule against it? And if not, can it be justified? And with our staff, I would say, you know, as long as it's supporting someone in staying safely housed, we can consider it. And then we took some time to go through all of the VOCA rules and kind of connect it to some of the activities and interventions that we were doing that were beyond just rental housing. So it was clear to us that, yes, you can use this funding for rental support, but what about all of those other things? So I'll talk about that a little bit more when we get to Rainbow's story. And consider using at least some funds for clients needing significant support. So the way we broke down our model was to say we would help so many people with one-time assistance. We would help another group of people with, you know, 6 to 12 months of assistance. And then finally, we'd help a small group of people with up to 24 months of assistance or some significant support. And that goes beyond just rental assistance. It also looks at how can we assist with child care and other things to support the family who really may be starting with absolutely nothing. And then how do we manage that financially? So really trying to figure out how to ensure that we're going to have money throughout the grant period. How many survivors can we serve with the significant support versus the one-time support or the up to 12 months of support? I think one of the most significant things for California was creating a learning community for agencies who are incorporating domestic violence housing first into their work. And we're fortunate that our California partnership to NDV has created a listserv of DV organizations and advocates who are doing this work. So that's a great way for us to share information amongst everyone who has been funded to do this work. And like I said, that first year we did 3 in-person meetings, and then this year I know that there's been at least 1 in-person meeting with the additional agencies who have been funded beyond the pilot. So Rainbow Services, beyond having DV Housing First funds, we are also funded under a Continuum of Care Rapid Rehousing Grant. We're a subcontractor with a local homeless organization. We were one of the first in LA County to have a DV Housing Advocate co-located at a coordinated entry site. We also receive a number of Section 8 vouchers, so we're able to help persons who are ready to move into permanent housing with any of these opportunities. And one of the other things we've done in the past couple of years is collaborated with a homeless service organization, the Downtown Women's Center, to create the DV Homeless Services Coalition, recognizing that we really need to break down some of the silos we're working in to be able to support our community members because we're serving the same population. And so how can we work together to make sure that survivors are not falling through the cracks as we turn them away from DV services because we think they're just homeless, or homeless services turns them away because they've disclosed domestic violence. So the coalition really looks to build a stronger system that supports survivors wherever they show up. And interestingly, there's one other organization in Los Angeles who isn't DV focused, Downtown Women's Center, who received the DV Housing First money. So just quickly, Rainbow Services is a traditional DV organization. We have a 24-hour hotline, emergency shelter, transitional housing, legal services, and all of the supports that one needs to try and find safety and stability. This quote on the bottom is actually from the outcome evaluation that's being completed right now, but I think it just really reflects the type of organization Rainbow tries to be in creating a welcoming environment. And I was just really proud to see that, so I wanted to share that with you. And for the housing piece, you know, we've really advocated for an ongoing continuum of housing needs. In Los Angeles, many of you may know, we have a really severe homeless problem, as many communities throughout the country do, and our emergency shelter and transitional housing programs are typically full. So being able to add DV Housing First has allowed us to serve more people and to also have an opportunity to support the survivors who are leaving our shelters. So we were part of one of the 8 organizations that were funded by Callaway in 2016 to pilot the DV Housing First model. In 2017, an additional 25 agencies were funded, and this year the Callaway is currently seeking bids, and they plan to fund another 25 agencies throughout the state. So this is pretty exciting news, and our learning community is definitely going to be growing. One of the things I did early on as part of being in the learning community and working with Cris and her team and with the California Partnership was to really look at the VOCA rules and what costs would be allowed. And so finally, we were provided with some direction on how we could use some funding. So under housing, we can pay for any number of fees in addition to rental assistance, utility assistance, and actually paying for utility arrears. We can pay for moving costs and any safety enhancements to a rental unit that a survivor may find necessary. In terms of household establishment, we can pay for essential furniture or furnishings, including appliances. I can't tell you how many refrigerators and stoves I have bought in the past year or year and a half. The guy knows me very well at a local appliance shop. We can pay for emergency food and clothing, documentation fees in order for people to get their documents in order to rent, or anything that the landlord is requiring in terms of documentation. And then other costs we have paid for include childcare, education, employment support, such as being able to help people out if they have a job that requires a uniform or they need new shoes. If they need assistance with getting to and from work, we can assist with transportation. We've assisted with auto repairs, as many survivors are one auto repair away from losing their housing. We can assist with impoundment fees, health issues, and legal assistance. What I don't see here, which I think I missed, was there's moving costs, but also relocation assistance, and we have assisted survivors with relocating to another community and actually to other states where they can be closer to their family or social support system. So some of the really important things around flexible funding is to be able to support with childcare. There were a lot of landlords initially who would not take third-party checks, and part of that is in Los Angeles County, we do have a lot of resources to assist homeless persons with rent, and so a lot of organizations are doing that, and landlords are not wanting to see a third-party check. I think there's some hesitation around taking a check, and the assumption being, will this person be able to pay with their own money once the support is done? So wanting to make sure that we have a relationship with the landlord to explain what the program is, as long as we have the survivor's permission. We've used the funding to pay for a storage unit while the survivor waits on permanent housing. We've paid for essential appliances, which I've already talked about, and the cost of auto repair. And here it is, relocating to another state, including assisting with the initial household establishment and identifying potential support services in whatever area they are moving to. So we don't just kind of say, okay, here's where you're going, good luck. We definitely want to try and connect them to support services wherever they are going. And let's see, so for Rainbow, we have served 75 individuals or families within the first 18 months. We've exceeded what we said we would do initially, was that we would serve 50 families over the course of 24 months. Though because of the varying needs of the families, we've just been able to help out more people, including 19 persons with low needs, so that, again, one-time assistance or one move-in fee or credit check. And then the medium need is anywhere up to 12 months of rental assistance, or could include a high-cost car repair. And then high need, this is really interesting to me. We thought that these numbers would be reversed, that we would serve a lot more people with low need, but we've actually ended up serving a lot more people with high need. So that means we're assisting people with rental assistance of some sort for more than 12 months. So these 36 families have been receiving rental assistance for more than 12 months, and at some point we start, we may start a survivor off with supporting her full rent or his full rent, and then after a number of months, they begin to pay a portion of that rent. And so at the end of our rental assistance, they take on the full responsibility of the rent. And that could be anywhere from, 12 months to 24 months of rental assistance. But we're just actually getting to the 24-month mark this year. So the average length of assistance is almost 7 months. It ranges from 1 to 16 months. 95% of our flexible funding is going to rental or housing support. So now you know who we are on the previous chart that Chris shared. And the range in support really varies from $35 for a one-time application fee to, I think, the family that we continue to serve, we've spent about $17,000 on them because they have high needs, including rental support, high security deposit, and auto repairs. The average support per participant so far is about $5,800. So that is Rainbow's program, and I'm happy to answer any questions after Chris wraps this part up.
Okay, thanks, Elizabeth. I was on mute. Thanks for reminding me this all happened in 9 months. I sure felt like 18. We did get a lot done. So just to conclude, we tried to just stress for you that this does seem to be a very promising model. It's not the only model out there, and we don't think that we should all be looking for a one-size-fits-all model. This is just one of many. We think it's important that states and communities offer a range of models for people. But this one does seem to be very promising to prevent homelessness and stably house people. Because this work has been getting a lot of attention, there is now a toolkit that's on the Washington State Coalition Against Domestic Violence website, so we've shared it here, and you will all get a PDF of this talk so you can have it. You can also just Google DV Housing First Toolkit and it will come up. That we're trying to get very specific in that toolkit about helping people with what they need to do this. Wanted to just do a shout out to the other states that are finding success with this model or giving it a try. I think it's just really important that we continue to learn, grow, question, refine, figure out how this works in different communities. I know even OVC is still figuring this out as they go along. Some people are using a combination of OVC funds as well as private funding, so that if they're not sure if OVC would okay an expense, then they can use their private funding. So I think a lot of people on this call are used to sort of braiding funds like that. But anyway, we wanted to make sure that we gave you time for questions and discussion, so I'm going to go ahead and open it up. I tried to answer a few questions in the text box, but Susan, I don't know if you had any that you want to get us started with.
Sure. We have had quite a few questions come in, and of course there were a lot of questions and answers. Thank you, Chris, that you were handling all along. The first question is from Jenna. Would other essential furnishings that you can provide with this funding, would that include things like beds and couches?
To my understanding, yes. We typically have paid for appliances, and we have a connection to a mattress store locally that donates mattresses to us, as well as a connection with a philanthropic group who helps survivors with kind of household establishment if they live within a certain area in the surrounding community. So we haven't spent as much on furniture because of those other supports in the community that we have, which is actually part of that community partnership piece of the model.
That does make sense. We have a question from Jane that talks about the interaction of different types of services. So much of what you described was managing the housing dollars and other supports like childcare, jobs, access to health care. Where in that coordination of services does the trauma work come in that's being delivered to the survivor? Because you have different skill sets for coordinating those tangible services versus providing trauma work.
Yes, agreed. Though, as an organization, Rainbow has really made a commitment to shifting toward trauma-informed culture. So everyone who works for us has some level of training on trauma-informed care. I think some of the trauma work happens as part of the mobile advocacy, though other pieces would include connecting them to our family counselors or support group. It depends on the needs of the participant. I mean, some participants really just want the housing assistance and aren't ready or have already worked through some of their trauma issues. Others are very much connected to our services at our resource center where our housing staff is located. So they're very much more integrated with our other staff, and when they run into issues where the participant may be needing more emotional support, then they definitely refer them, though I feel that our housing staff is also providing a level of emotional support through their mobile advocacy that is trauma-informed.
Great. Elizabeth, this question is directed to you from Amanda. Over what period of time did your work with the 75 families take place?
So we didn't get started until December 2016, so those numbers were about a year and 7 months, so from December 2016 through June 2018.
Okay. And how many staff support your Housing First program? This is from Maria. And then I'm wondering, how does that compare with your cohorts?
Yeah, I would say not enough. Initially, we hired one advocate who had been doing the Continuum of Care Rapid Rehousing program. So she was the first housing advocate to be co-located. When we got the Housing First money, we promoted her to the Community Housing Coordinator, and she's essentially been kind of in charge of either supporting the families herself or assigning one of our housing advocates to do it. So we now have the coordinator, 2 housing advocates, one that works specifically on that rapid rehousing. Though, you know, even with that rapid rehousing funding, it's really strict, and the families tend to need more support, so we can help them with other things beyond rental assistance. And so that housing advocate is also be able to utilize these Housing First funds. And then finally, we have a support staff, housing program aide, who does a lot of work in entering data into the tracker that Chris mentioned, in being the liaison between our finance team and our housing team. She goes through every request for funding to make sure that the proper documentation is there. She answers calls. She supports the staff. So we have 4 total and 2 different funding streams.
Great. Now, we're going to continue with the Q&A, but we're going to go ahead and have the exit poll open for anyone who has to leave a few minutes early. But our next question relates to, and I'm not sure whether this is for Elizabeth or Cris, can you explain the difference in the use of OVW funding versus VOCA funding to pay delinquent debt or debt that is in arrears?
Elizabeth, I think that's for you.
Okay. So my understanding is that we can pay debt that is in arrears. There, I think on that list I had utility arrears, and I know that I think I can only recall one instance in which we paid for a survivor who had some back rent due. But when you think about it, if that prevents them from becoming homeless, it's a lot less expensive to pay their arrears than to have them move. I don't know if that answered the question. I believe it's acceptable under VOCA. We can't pay, someone's mortgage or past mortgage payments, but in terms of rental assistance, I believe we can.
Yeah, and I would just add that OVC is leaving some of this up to the states, and I don't have the exact wording, but they just want states to be consistent in how they give these grants out. So it is going to vary by state, and not everyone's going to be doing it exactly the way California is, which I think has been pretty flexible. But it is allowable, is our understanding.
And they did finally come out with an allowable expenses chart, which that's what I kind of shared the topics with you, though they also provided us with what documentation would be needed if we use each, depending on the category of funding we're using.
Great. And we had another question from Jean that related to her VOCA administrator, but I think it applies more broadly. What do you recommend that a program do to see if their state VOCA administrator would be willing to try the DV Housing First model or one of the other models out there?
Well, I think in California, our state coalition, which is California Partnership to NDV, really pushed this model a few years back when we were seeing an increase in VOCA funding. They were kind of responsible for reaching out to Cal OES and saying, hey, we really need to pilot this model and see if it works. And then once they agreed to that, I felt really strongly that we needed to evaluate it from the beginning, and that's when we approached Blue Shield of California Foundation to be able to start that process evaluation right away rather than waiting, a year into it to start it. So I think we're really fortunate that we were able to do that and that the evaluation continues on some level.
All right, and here's a question from Cindy. Cris, you addressed this a little bit earlier, but if you can talk about it again. She's in a community that has no available affordable housing. They do have a housing navigator who tries to locate housing and landlords. Do you recommend that her community try to get involved, or should they be leaving it to the other partners? Or what do you do where the local situation is just so dire in terms of affordable housing?
Well, I imagine Elizabeth has something to add about this as well, but I'll just say that that's exactly the kind of community I think that needs to do this. Because what that means is you have to be extremely creative. You've got to help people stay in their homes then so that they don't become homeless in the first place. And these funds and other funds can be used to do that. It also means being really creative because there's no such thing as there's no housing. There is a little bit of housing, and you've got to have the strategies in place to have those partnerships in place to get that really limited housing, and these funds give you that ability. But Elizabeth, I know you've dealt with this.
Yes, I mean, we're in Los Angeles, not just in LA County, but in the actual city of Los Angeles. I mean, I think the latest out of reach report said that you need to make $32 an hour in order to afford a 2-bedroom household here, so a lot of our families that's not possible. I think part of what the flexible funding allows us to do is to look at the models of housing that families are already engaged in before they even get to us, meaning they may be doubled up in a home, they may be renting a room from a family member, whereas if you're using HUD Continuum of Care funds, they want to see the person's name on the lease. They want to see a certain amount of bedrooms depending on the number of family members. So I think it helps us to be a little more creative, and not that we don't have to get lease agreements or some type of rental agreement with the person's name on it. It's just there's not as many strict rules to how we utilize this fund to support the family. And I think the other thing is the length and time in which we can support them and the level of support that we provide. We have not put a cap on the amount of money that we will spend on any one individual. We've kind of looked at that, though also have this kind of openness or expansiveness to be able to say, okay, even if we put this cap on, we understand that there's some families who are so super needy that we're going to be supporting them for a while.
Okay. There's another question here from Robin. What was the overall budget for this program?
So in California, for ours, we were awarded $300,000 a year for a 2-year contract, which they then extended another 6 months. I think part of it was because realizing that many people were not getting started right away unless you already had systems in place. It took a minute to get started. So $300,000 a year and then each year over the course of 2.5 years. And we're hoping that it gets extended beyond that as well.
Great. So we had a very timely question from Dean, who's wondering whether folks can get a copy of the Q&A from today as an attachment along with the PowerPoint, which I think would be a very good idea since we aren't going to be able to get to all of the questions by the end. Please keep submitting your questions, and we will have another bit. We'll go through the Q&A that we already have and make a little document to circulate with the recording of the webinar. So here's another question we can get to. How are possible participants vetted? Is there an application process that has to be completed, or is anyone who comes to the agency and says that they have a need, are they given funds? You talked about trying to, Elizabeth, talk about how many families you expected to serve in which category of need. Do you vet, or what do you do?
That's a good question. I think, we were very open in the beginning to providing some level of service to anybody who asked, and we created our community housing department, which is kind of separate from like our case management or counseling and other support services. So in the beginning, we had case managers referring. We were looking at the families in our shelters to see how we could assist them in moving on into permanent housing. And then really, so we didn't open it up per se. We went with the people that we were already serving, and we put that in our application, that we weren't going to be opening up so that anybody walking off the street could come in and apply for this funding, though, some have heard about us since then, and so they come to services. So a lot of the referral came through the case managers, and it was a matter of letting them know what are the allowable costs, what are the other options in the community. So again, having that connection with housing and homeless services is super important, because certain families may qualify for other types of funding through the Continuum of Care. Even though it's super restrictive, they can qualify for that, and then we can supplement some of what they need with the Housing First funds. So we continue to remain open to different referrals, knowing that we're not going to be able to serve everyone. And at one point earlier this year, we had to stop taking any referrals, because if we didn't, we were going to run out of money pretty quickly. So you have to really keep an eye on how many people you are serving in that high-end category, because if you think about how much you're spending on their rent, even if you're tearing it down over the next 12 months, that's still going to be an ongoing cost. So can we afford to keep bringing people in if we have more families in that high-end category, or even that medium category, because that could be rent for up to 12 months.
Right.
So I hope that was helpful.
Yes, thank you. And thank you both very much. This has been a fascinating session and has really spurred a lot of ideas and a lot of conversation. We will have a few more questions that we'll try to get to in the follow-up. Cris, are you trying to break in with something?
Nope,
okay.
That wasn't me.
All right. Well, I just want to thank you both again, and thank you all of the participants. Again, if you want a certificate of attendance, please send an email to ask@victimresearch.org. ask@victimresearch.org. Cris and Elizabeth, thank you so much.
Thank you. It was a pleasure.
Thank you.
Bye-bye, everyone.
Bye.